Good morning, everyone. This is Dr. Prashant Reddy, consultant physician from Renovo Hospitals. Today, we will speak about viral fevers. Why it is important to speak about viral fevers or have a discussion about viral fevers is the coming season is a monsoon season where we see a prevalent of diseases of which the viral fevers are most common and most prevalent also. And there are so many things that people just miss upon and leads to this transmission of disease from one to another. So we'll just have a brief about this thing. So how do you see and what are the symptoms or signs that you see in the viral? So the most common viral fevers are the common cold or cough, which are generally transmitted from a person to person due to droplet infection. So how does this transmit? So most commonly people getting the viral fevers have the symptoms such as cold and cough, and when someone with the cold and cough sits beside you or is in a close contact to you, there is a high chance that this disease transmits from them to you and from to you to others. And this happens to be seen most commonly in these seasons because of the schools being reopened and the children in the schools getting infected, and from there this infection spreads into the adults and the other people in the household. So what are the symptoms or signs generally the people or the patients presents with? So generally we see people having cold, cough, high grade fever, headache and severe body pains. So it's important that we distinguish this common cold or common cough viral fevers with the other viral fevers such as dengue or chikungunya. So it's important that you meet or visit your nearest physician and get the required investigations or the examination to be done and to be distinguished whether it's a common cold and common viral fever or is there anything else. So how can this be treated or prevented? The treatment for viral fevers is nothing but treating the symptoms. There is no role or requirement of the antibiotics in the viral fever. So it's a request that not to do self-medication and just take the medication whatever is required from the doctor or the physician. So we generally give the antipyretics, that is for the fever, and the antiemetics or the other drugs which are required for the cough or the cold. And how can it be prevented, or what are the other things that will help in the treatment of this fever? The most important thing is taking fluids. The required amount of fluids, generally we expect the fluids of 3 or 3.5 liters to be taken minimum in a day, giving ample amount of rest, that is 6 to 7 hours of sleep in a day, and taking good amount of food, that is protein and carbohydrate. And how can this be prevented? This can be prevented by using masks, regular washing of the hands and the legs, and taking good care of the hygiene. So any more queries, please contact us at Renovo Hospitals. Thank you.